All right, so this talk is on FUE, follicular unit excision basics. It's really for people that don't practice this or just starting out. And even if you're a moderately to advanced practitioner, I think it's going to give you some tips on how to perform better. But before we start, we have to first understand that when we hear FUE, we think it's sexy and that's the only way to do things. So when all you've got is a hammer, the world is a nail, I still perform a lot of strip procedures because there are really good indications for that. What are they? So one is women. I mean, to me, you can do FUE successfully in women, but the problem with that is one is you have to shave the scalp, and if you don't want to shave it, you have to do these windows, which creates more scarring in my opinion, creates less density, takes hairs out of the zone that is in a good area, which is the central occipital region. Or you do non-shave, which takes you 2 days, the person's lying there and you're exhausted, they're exhausted, there's just no reason. My scars are so difficult to see that most hairstylists send them to me because they can't find my scars. So if it's done well, it should not be an issue, and it helps preserve visual and palpable density for women. I think FUE is not very effective in extensive baldness. Why is that? The problem is that there's not enough hairs. When you pull FUE, you can only pull a small amount out. How much? That's a whole long discussion, but I would say between 15 to maybe 30% on higher density cases. And when you have a very small fringe on the backside, you don't have enough. And the other problem is you're going and abutting what's called the safe donor area. What does that mean? Well, graphically, if you think about it, it starts to shrink. And so with FUE, you have a very wide zone of harvest, whereas strip, you're in the very heart of that central safe zone. So when we're doing these very extensive FUEs going to the fringe of the crown in young patients, I think we're creating risk. So that's a problem. So an easy spectrum here is that with strip procedures, I look at women, low shingles, in other words, the hairs come down, I'm a high shingle person. Longer hairstyles where I have to shave it. If they've already had prior strip scars, there's no reason, or extensive baldness. And older people just heal better, So I love FUE in the right cases. We'll show some clinical cases at the end where I think it's helpful, but more limited loss, areas of high shingle, younger men, frontal loss. But when we have extensive baldness, I'm not a go-to for FUE. But in certain cases I will. So I first start with the hairline design. When I first walk into the patient, I set that frame. I'm not going to talk to you about how to do that. That's extensively written about and discussed, but that's why I start. And then after that, we plan the donor. So the donor is shaved down with a zero guard. When that is all ready to go, then you mark it out. So you say, well, why do I have to learn how to mark? Because you know what? It's never talked about. We assume you know how to do this, but I'm assuming you don't know how to do this. So first I mark a midline, and then I mark the top line, and then I take a ruler and I measure from the center all the way to one side, and that's going to tell me how long it's going to be on the other side, so I get a symmetric harvest. And then from that, I'm going to close it off from the sides and the bottom, and now I've got a defined zone that I'm going to harvest in. And from that, I'm going to divide them into 3 to 4 centimeter squares. So what does that mean? Well, here's an example. This is about a 10 centimeter midline, vertical line, and I'm going to divide those in about 3.3 centimeters. So it's not exactly 3, not exactly 4. It doesn't matter. You're just making these boxes so that you can count the grafts. And I'm going to talk to you about how I do that in a moment. And so I'm going to just divide these into equidistant roughly 3 centimeter boxes. You can see in the lateral region where there's more sparseness. You don't want to go too high in your harvest. I'm doing larger boxes because it just naturally fits that at 4 centimeters. You can see those lateral 3 centimeter boxes are slightly smaller because they're slightly more compressed. It doesn't have to be exact. They're just ways for you to plan the harvest. And we'll talk about that in a minute in the chronologic sequence of how I do it. So we're talking about anesthesia. There are all different types of anesthesia. I don't need to drill it down, but I always like to start with nerve blocks. The reason, especially long FUE cases, it helps keep durability on the front side of the scalp in terms of anesthesia. I find that ring blocks start to fail somewhere by the mid to late days, so I use a 1 cc mix of bupivacaine with lidocaine, and the supraorbital block for the central hairline, the zygomatical temporal block for the lateral hairline, and the auriculotemporal block for temporal points. I detail all of this in my new textbook on FUE. I make no money on any of the books that I talk about. Tumescence preparations basically is very simple. You can take a photo of this, but the FUE donor is really just a dilute bupivacaine. And the trick with getting low toxicity, durable anesthesia is a field block. And so with FUE donor harvesting, you do not want to use a ring block to get your anesthesia. And so what we start with is these little tiny blebs just to create the first anesthetic block, and then I raise wheels with this dilute bupivacaine blockade. And I just raise that all the way across the entire scalp, going from the occipital nerve and expanding from that. I've been using an alternative tumescent technique with a pressure bag. And Eli, go and run that video for me just for a second here. No audio, please. And so you can, all I'm doing is a 20 gauge long spinal needle. You don't want to shove it through that area, but just slowly raise it. And what this does is it provides your hand less taxing to it, but also it allows you to create a very fast tumescence of that zone using the same tumescent fluid. So I then finish the ring block. It's given some time for the nerve block in the front to work, and then I just complete that with the dilute lidocaine, which I'm going to reinforce with some bupivacaine at the end. So the key first is figuring out, before you make recipient sites, which is the first thing I like to do, is I need to harvest 1 or 2 hairs in different regions of the scalp to measure the length and the size, because I want to make sure that the sites that I make are going to fit the grafts that I'm harvesting. So I first harvest 1, 2 sites or so. I usually do it from different regions of the scalp because they're different lengths, so you don't want to just take it from one area. And from that, I test everything, work with my assistants to make sure everything fits, and then I design the recipient site. So for me, I always like to start with the site creation. It's a very creative part of the procedure. It's a lot of fun, but it also defines for me what I need in terms of grafts. It allows me to say, well, I need this number of 1s, I need this number of 2s. It tells me total number of grafts. It allows me to target what I need as I'm planning the procedure. And from that, now we go back to the concept of those boxes. So how many boxes? Let's just say I have 14 boxes, and the one that I showed you had 22, but this is just some math. So let's say I made 2,000 recipient sites, and I have 14 boxes. Well, the simple math then is 2,000 divided by 14 means I'm going to harvest about 142 grafts per box. That way I can plan it as I'm going through the harvest process. But you know, you look carefully, that central 8 boxes are much higher density. So you want to be harvesting higher proportion in that central density and fewer on the outside. So you just do math. Let's say I want to be harvesting about 175. You multiply by that by 8 and then subtract it from 2,000 and divide the 6. You get 100. Does that make sense? I hope that math is not too complicated. If it is, I'm welcome to speak with you afterwards, for this. This is the revolution. As I said, I just released a new textbook that came out last month. It's 4 times the size of my first textbook on just FUE. And the reason why is this technology that came out in 2017. To me, this is state of the art. The idea with the trumpet punch, for those that don't know, it has an outer sharp punch and an inner blunt dimension. And what that allows you to do is to get the cleanest grafts that are almost at the level of strip quality. And the survival has been shown to be the same. So the outer sharp punch allows you to go down and dissect it, and the inner blunt punch gives a very soft facing edge that it minimizes transection. And instead of the high velocity rotation, now they're being cradled down with a slow oscillation mode that allows you not to have that kind of rapid cyclical injury to the grafts during high rotation of the old technology. So the 2 ones that are the forefront are the WOW by Jean Devois and Trivellini device, formerly the Mamba. I use both of these. I'm going to talk to you about how I use both of these, and I actually own 2 of each one. I don't have any financial affiliations with anything stated in this talk. So how do I use it? So the WOW has incredible feel. It uses a foot pedal, although they have a new wireless device that I believe is now is different. It's also featured in the textbook. I'm still using the old school method. I love the old school one. It has a great feel to it. The Trivellini also has a great feel, just not quite as subtle as the WOW. So when I'm having difficulty harvesting, my go-to is the WOW. When I do beards, which we'll show you in a minute, I do the WOW. I find it much easier to harvest in that lax skin that has a lot of angle changes. But speed, the Trivellini offers me speed. The reason is the next one is Smart React. I just touch the skin and it starts to go. I don't have to gauge my foot to the pedal, and it's very fast. It has a suction built into it, and it's multiphasic. What multiphasic basically means is, I told you that the rotary system is now sort of gone, the high rotation, but the Trivellini allows an initial rotation to score the dermis, and then it converts to a oscillation mode that cradles down through the dermis into the subcutaneous tissues to protect the graft, and you can actually modulate that. So for example, if I'm harvesting lower down, like into the lower occiput where the dermis is thicker, I can adjust the trivellini to a higher rotation, longer rotation time, and adjust to a shorter oscillation mode, for example. The third phase of the mode is a vibratory method to shake the graft free. I don't think it does a lot, to be honest with you. I don't think it's critical to have that. I don't even really care what that parameter is in terms of how I use it. This is important, magnification. This is I think this is an outdated version. It's Surgitel, not designed for Visions. I don't make any money from any of the companies, but they make 8.5x magnification. It's incredible. That level of magnification allows me the ability to see so clearly without eye strain, and that's one thing I want to emphasize. Position is important. So for me to access the right and left sides of the scalp, I sit on top of the patient. It is much easier to harvest both sides than sitting on one side of the patient. You can adjust up and down to the patient position and where your position is to make sure it feels comfortable. You can turn your head side to side and make subtle adjustments to see angulation changes. Because you look at one side, you realize, hey, I'm transecting. You can just move your head back and forth. So sitting on top of the patient with proper magnification, to me, is critical. And the first thing you want to do is line up the graft. Oh, okay, shoot, this is the outdated version, darn it. Okay, no big deal. I have another little graphic that's not in this one. I thought I had tested this as the newest version, but it doesn't matter. The trick with lining up the graft is high magnification, so your eyes are not strained. What you're looking for is the insertion of the graft through the skin, through the actual epidermis, and that's what you're looking for. Don't look at the tail end, because the tail end is, if the hair is curved, you're going to be not aligned properly. You want to center the punch and look at underneath the skin. But guess what? Sometimes that's even wrong. And especially in African Americans, a great example where you actually have to go a little bit more vertical, going down perpendicular to get the right angulation. So use that as your first lineup. If that lineup fails, it means that the graft is not right. Now, how do you know it fails? How can you adjust? We're going to talk about that in the next slide or two. So this is it. It is actually interesting with FUE, you think it's all visual. It is actually about, I would say, 50-50. I can see it and I can feel it. Maybe it's 70-30 where I'm actually feeling more than I see. So what you're feeling, when you start to get good at this, you can feel the sidewall transection. You can feel it. It's like when you're doing anything else from rhinoplasty, facelifts, you get a feel for the tissues. You're not just seeing the tissues, you're feeling them. And you can feel a dermal release. You can actually feel this little give. Now there's a different feel of a transection release where you're going wrong and you just punch through it. But there's this release that comes down, and you can actually feel the punch suction in. If in some tissues, if it just glides in, it's pulling that punch in, you're at the right angle. And of course, you're confirming that through transection. And as my staff are actually pulling the grafts out, my side eye is looking for transection, and I'm asking them, are they getting transection? And my eyes are everywhere, looking at the harvest, looking at them extracting from my pull, and confirm the depth. And so in the old days, we had punch depth limiters where it told you had to go to 3 millimeters or 3.5 millimeters. These don't have them, but guess what? You don't need them. Because what happens is repeatedly harvesting at the same length, a little blood stain will show up on the punch itself, and that will tell you the depth. And so you're just going to go to that same depth. I always cross-check too with my staff. I'll ask them, I'll say, hey, are you getting transections? Are you getting clean grafts? Are you getting good connective tissue? Because sometimes what happens is they can pull the graft out easily, but there's loss of connective tissue on the bottom because they're pulling it out and they're yanking the bottom portion of the graft out. So ask for, how is your connective tissue looking at the base of the graft? That's very, very important. And so quality reassessment is constant. You're not just harvesting blindly. You're constantly thinking. I'm constantly thinking as I'm harvesting. And these are all points. So feel it and look for it. If you're seeing a transection, where's the transection? If it's on this side, you know that you're coming in too much at this angle. You can adjust. Feel it and see it. That's the big lesson. Graft should really pop up at the end. It's a confirmation that there's a little bit of a give while the graft comes up. If you see the graft actually pop up a couple millimeters, that's good. If the graft is so released that they need no pressure to pull it, you've actually gone too deep. So it's not only a risk of transection, but you're actually causing more tissue trauma than you need to. And so I want them to actually feel a gentle release, not a complete full release when they're doing it. So, and then this is just showing this. No one has really done this, but this is the top, is the bottom's top. So in other words, I'm sitting on top of the patient looking down. So as I harvest, I harvest and I start to go down. I'm always looking. I'm always thinking, where's the next harvest? Because you don't want to leave multiple ones close to each other, you're going to get an over-harvested result. And what I'm looking at is how it shingles down. So picture the top, the hair is going down this way, okay, like this. So I'm thinking, here's a hair going over this hole. Will I have a hair to cover the hole? So as I'm going down, I'm thinking, what's above me, so that I know that I'm getting proper protection. And otherwise, you're going to get problems. Does that make sense? And the other thing that I'm doing is I'm not only just looking at all of that, I'm trying to stay in a decent, clean pattern, because the hairs grow in certain angles. Once you get the right rhythm of a certain angle, if you jump all over the place, not only are you not going to get the numbers you're accounting for, and it's hard to harvest, but your angles are going to change. Angles change over here, over there. So if you can get a certain pattern and grow from that pattern, like I'm showing you here, then essentially you're going to be able to harvest much more quickly, because you're harvesting in a way that will allow you not to have massive angle changes with every single harvest maneuver. And you're making subtle adjustments in vision and feel as you're going. So this is important. This is a quick video. Eli, can you play that for a second? This is just showing that when I do a beard, I use the wow because it gives me a more tactile feel, especially in even Tumescin, and I have to change angles. There's always angle changes. It's not as easy as a scalp. And so the other thing is placement. When I do a strip procedure, I actually have a hair curl that's visible because I leave it trimmed a little bit longer. You can't do that with FUE, or it makes it very hard to harvest. So what you're looking for is the epidermal cap. And that cap, if it's backwards, won't sit right, and that tells you if the curl is right or wrong. Why is the curl so important? Because if you put the grafts backwards, they'll grow backwards. And they're going to be hard to comb. They may look unnatural. They won't provide visual density. So there are a lot of issues, especially the hardest area where you're going to have problems are going to be in the temple and in the eyebrows, which I absolutely recommend you don't start with that. And then these are some examples of mine. This is a strip scar that I corrected with FUE. So I'm going to show you different indications. This is an FUE scar. This is a scar, traumatic scar corrected with FUE. Great example where I wouldn't do a strip in him. Too much risk of visibility of the scar because of a high shingle. Great example of limited loss. FUE is awesome. African American men in particular are great for FUE. For African American women, my go-to is strip. I just don't see a reason for that. This gentleman, FUE eyebrow beard transplant, I just actually came back a couple years later and raised his beard even higher with FUE. The FUE was awesome because I was able to harvest one hair grafts. So the opposite of over harvesting, I'm able to preserve that density by just selectively taking one hair grafts out for his beard. And I did some two hair grafts as well that were finer, and able to cherry pick is the word. And that's one thing FUE affords that the strip does not. And then strip mega sessions are just so awesome. I mean, if you can do this, the problem is it requires a lot of staff training to get up to speed to do this, but strip mega sessions, you preserve the donor capacity, you stay within the safe donor zone. I just don't think you can accomplish this reasonably and protect the donor capacity when you have massive hair loss with FUE, except in the highest density individuals. This is FUE correction using FUE. This is an FUE correction of mine for 2 strip procedures. This is a combination of, there's several bad strips done in India. This gentleman, I did a beard FUE because they burned out his donor hair, but he had great temporal hair for a strip, so I combined those 2 for him. And this is a strip with beard FUE, same thing I just did in the last gentleman to correct plug and a slot deformity in his crown. I was the president of the American Board of Hair Restoration Surgery last year, really proud of my affiliation with that. I encourage you to sign up if you've been able to perform enough procedures to be able to sit for this exam. My textbook, as I said, all the proceeds go to stop human trafficking in the world through lovedoes.org, so I make no money on this. 1,300 pages, 1,600, it's almost 18 hours of videos, all QR code linked to almost 120 videos and growing every day. It just came out last month. And this is my course. I encourage you to come. I make no money on that either. All my honorary are given back to St. Louis. And so this is in end of July, so I welcome you to come. And I'm a minute under.